Good afternoon. While everyone's getting settled in, I'm going to ask you to answer with a show of hands. How many of you have ever used a dating app? It's maybe about half. And do you think dating apps should help people discuss sexual health topics? So maybe about half again. So I'm Dr. Celine Gounder. I'm a physician, epidemiologist, and medical journalist. I'm also a CBS News medical contributor and the editor-at-large for public health at KFF Health News. On this panel, I'm actually going to be not only a moderator, but also a panelist. I'm the co-founder of a company startup called PlumCheck, which is a new digital tool to help people securely share verified sexual health information like HIV status, STI testing dates, and vaccination history. And I'll tell you a little bit about PlumCheck, get my panelist duties out of the way, and then we'll jump into the moderation and what Mohan and Jen have to say. So the idea for PlumCheck was born out of my own professional work. I'm an infectious disease specialist, an epidemiologist, and during the Mpox outbreak of the summer of 2022, I wrote an op-ed with a colleague of mine for Stat News, my colleague Mike Donnelly, who's a gay activist in New York City, also a public health data geek. And we wrote about the failures of our fragmented public health system, why we were not able to get information on Mpox testing, vaccination status, seamlessly across health systems in a way that these men could make use of the information and share it with each other. And then we also asked the question, what role could dating apps play in actually pulling together that information, making it available to their users? Meanwhile, over the past few decades, rates of STIs have been on the rise, which has been fueled by cuts to public health programs, some of this going back, as you might remember, to the 08-09 recession, so this goes even further back than the post-COVID times. Declining condom use, which we've seen over the last decade, trends in substance use, and then later the disruptions of the pandemic and casual dating app-based encounters. So almost 2 years later, on a personal level, I have found myself navigating dating apps for the first time. So I lost my husband 2.5 years ago. We met in the mid-90s, very different world. This was before we had highly active antiretroviral therapy. And for those of you who are my age or older, you'll remember we were really afraid of HIV. And so things like having a conversation about sexual health, using a condom, was much more normal than it turns out it is today. So that was a bit of a learning experience. And so I have a very good gay friend in New York City who was sort of mentoring me on how to re-enter the dating world. And we were having conversations about his experiences as well, somebody who's been on Grindr and all the apps since they ever existed. And we were recognizing many of the same pain points and safety issues and health issues. And so that's when we realized that if we wanted to see change, we might have to do it ourselves. As many of you know, public health is currently under attack. STI programs have never been adequately funded, even when public health was as well funded as it ever was. And philanthropic funding for STI prevention is nearly non-existent, in contrast to HIV. So the idea here was to leverage the private sector in service of public health and to empower people to have conversations about sexual health and share relevant information in a secure, private, and verified way. So that's my panelist shtick, and now I'm going to turn it over to my co-panelists who've been working in the dating app ecosystem for far longer than I. First Mohan, and then Jen, if you want to introduce yourselves to the audience.
Great, thank you, Celine, and I just want to say what a pleasure and honor it is to share the stage with you and with you, Jen, so it's really great to be here. My name is Mohan Sundararaj. I use he and him as my pronouns. I'm a physician by training, have spent a lot of my career working on global health, increasing access to HIV services for the gay community in over 30 countries, mostly in Africa, but in every region of the world. I also represent Grindr, which is the world's largest social networking platform for gay, bi, trans, and queer communities. I've only been at Grindr for about 4 months, which is not entirely true. I've been a Grindr user for much longer than that. Grindr is has about 14 plus million users around the world, which I believe is really our largest capital, is our access to community and the fact that we provide a safe space for communities to kind of connect with each other. We have a social impact initiative called Grindr for Equality that was founded in 2015. That's about 10 years old, and so I'm its managing director. And Grindr for Equality is 10 years old. It's done a lot of different things with the community around the world. We've been in every region of the world. We have a footprint in over 100 countries, have given grants to grassroots organizations, done in-app campaigning work, and the work that we do sort of cuts across health, human rights, safety, and community resilience. So I'll stop there and maybe pass it to Jen.
Thank you, and a pleasure to join you, both of you. And thanks for having us here. I want to say I'm Jen Hecht, and I am it's such a huge pleasure to be here. I've been loving the sessions, so I hope that we keep you as engaged and entertained as I have been so far. But for the purposes of this, just very brief background, I've been working in nonprofit sexual health spaces for many, many years, and I co-founded and lead a group called Building Healthy Online Communities. We partner public health and dating apps for the purposes of increasing access to health information and resources. And I will share a lot more about that as the panel goes on.
Thanks. So I'll start with you, Jen. So you have been partnering with dating apps since long before that actually became more common. What are some of the most effective public health interventions that you've helped the dating apps launch?
Yeah. So I think I will start by saying, how did we get into this? And I know you all are here for sort of an uncommon allies topic, right? So how did we, as public health, start working with dating apps? Back in about 2009, I was working in San Francisco, and the San Francisco Health Department at that time had a syphilis elimination task force. For those of you who are following syphilis rates, that may be hard to believe, but back in 2009, there was a real belief that there might be a possibility of eliminating syphilis.
And to be clear, the rates have gone up.
They've gone up a lot. However, that was a real focus at that time, and in those meetings, there were opportunities to sort of review reports and really think about, what's happening. So what that looked like were there were disease investigation specialists, or DIS, who do contact tracing, and they would interview people who had recently gotten syphilis and collect information and try to understand, what was going on, what's happening in the community. And part of that was to understand, where were people meeting. And so what we were seeing was, of course, people were meeting in bars, people were meeting in sex clubs, people were meeting online. And at that point, we were starting to see more and more commonly that folks were starting to meet through dating or hookup websites like gay.com or manhunt.com. This was actually before Grindr existed. So that was kind of in the way that we have been for many, many years partnering with gay bars in the community. We recognize this opportunity to start reaching out to these businesses. So that sort of began our work. And then to sort of turn to, well, now what? What have we been able to do? So we've built these relationships with many websites and apps that have become very long-standing. And I would say that there's sort of three main interventions or campaigns that I would highlight. The first is around outbreak response. The second is around in-app features, and the third is around self-testing. So in terms of outbreak response, to your point about Mpox, we actually working very, very behind the scenes. So while many of you may have heard of Grindr, I bet that none of you have heard of Building Healthy Online Communities. And that is okay, I don't take that personally, because really our work is meant to be behind the scenes. We know that Grindr is effective at reaching gay and bi men, MSM, people in the LGBT community in a very effective way, and that's why we build these partnerships, right? So in the Mpox response, we were able to work with other public health colleagues, and within days, we were able to get messages out through Grindr and other dating apps to people in the community. And what we did was take the information that was available about, what is Mpox or monkeypox, right? And, is a vaccine available, and how can I find a vaccine? And just take that and put it into sort of bite-sized, digestible pieces that the lay audience could take in. So that's one of the things that we've been able to do. The second thing is around how we work with the app product itself. And again, this happens over building relationships over time. But we have been able to make recommendations and work with apps to incorporate features such as being able to put on a profile that a user, as you mentioned, might want to disclose their HIV status. Again, that would be optional, or that they're using PrEP, pre-exposure prophylaxis, to prevent getting HIV. This is now fairly common on a lot of apps, especially in the queer community, among gay and bi men in particular. And we've worked with many, many apps to incorporate this feature over many years. And then third, I will just mention a self-testing program, which we'll also talk about during this panel. But in 2020, we recognized before that there were quite a number of dating app users that had never tested for HIV. And we saw this as a huge opportunity. And so we created an ordering platform to allow users to be able to easily order a self-test kit to their house. And in doing so, we knew, because we were working with dating apps, that there would be an opportunity to work with apps to promote that self-testing program. And that has grown substantially over the years, from starting with just a handful of state and local health departments to really a national distribution in the US, and now some global work as well. So I'll pause there, but those are 3 points that I wanted to bring up.
Yeah, and I think Grindr really should be congratulated for taking the lead in some of these areas. They are one of the few apps I have seen where you can report you've been HIV tested, you're positive, you're undetectable, you're on antiretrovirals, you're negative, you're on PrEP. My last STD test was X date. Some people will manually put in their Mpox vaccination. The straight apps do not do that. Yep. And straight people are not having these conversations. So I think you guys are really setting an example, and you're far ahead of where the straight community is in terms of this. Mohan, how did you get into this space, this intersection of public health and dating apps?
Yeah, it's a good question. I mean, I think for me, it comes from just growing up gay in a country like India, which, when I was growing up, it criminalized same-sex relationships, and I kind of know and I remember what it was like to grow up in that environment and not having sort of access to safe spaces, to community, to resources, be it sexual health or mental health or otherwise. And so I really wanted to make an impact on a much larger scale. And so even though I was trained as a physician, public health and sort of global health, I had a calling from that sector. And early on started working with the Global Advocacy Organization that was really interested in addressing HIV among gay and bisexual men in low-income countries. And here, in the 1980s, HIV was sort of isolated from a group of, gay men. And the advocacy movement here looked very different from what it was like globally. Mm-hmm. I think even until the early 2000s and close to 2008, 2009, there was kind of a silence at the global level amongst policy institutions. Even the PEPFARs and global funds of the world were not acknowledging the disproportionate burden that HIV was having, and a lot of that was driven by the lack of data. So I think we started having early epi data around that time where we could actually make the case that gay and bisexual men were disproportionately impacted by the epidemic. And in a lot of ways, we were able to kind of influence policymakers and make investments in the right direction. So we have PEPFAR and Global Fund policies, World Health Organization policies that are more friendly and inclusive and more commensurate with the epidemiological burden. And sort of fast forward, a couple of decades, HIV is still a problem, right? And so I think I'm really proud that Grindr has an unwavering focus on HIV and HIV prevention. And in a lot of ways, I think some of the things that we are proud of is thanks to your leadership, Jen, in terms of pushing dating apps to kind of do the right thing and to be inclusive of public health intervention. So I think it was sort of a natural progression for me in my career to kind of continue to focus on an issue that's really unaddressed in a lot of countries. We kind of take PrEP access for granted in the US, but it's still very expensive and unavailable for gay men in lots of different countries. So I think really wanting to help move that needle is kind of what brought me into this work.
And just following up on that, what do you feel have been some of the greatest successes in terms of public health interventions on dating apps, whether it's Grindr or others thus far?
Yeah, I mean, I think it's important to just recognize that even having a safe space is a public health intervention. So I think, the fact that in many countries around the world, gay sex is criminalized and folks are arrested arbitrarily or experience violence, Grindr is sort of the only place where they can go and meet other folks like them, right? And so it is a safe space, and I think that itself sort of helps build resilience and community connection and connectedness. I think beyond that, we are really proud that we give in-kind advertising space to grassroots organizations around the world. Last year, we ran about 1,700 campaigns, probably in about 80 languages, having about 85 million impressions. So you can sort of imagine the scale through which we kind of made that work possible. But all of that is giving access to nonprofits and grassroots organizations to our platform, to our users, so that they can promote messages around health, create information about services, access to services, also safety and security in places where being gay is criminalized or stigmatized, and that is also public health, right? I think anti-violence interventions, getting people opportunities for legal recourse in the case of crises, all of that is public health. And I think, to kind of Jen's point, I think our HIV self-testing initiative is something that I'm really proud of. We were, I think, able to distribute close to 500,000 test kits. And that's not an insignificant number, given that there are so many barriers to self-testing. In a lot of communities around the world, it's actually people stay with their families, so getting a mail test kit ordered to your home can be hard. Even sort of taking a test on your own can be a bit scary. And so I think the fact that we distributed that many test kits in about 6 countries is a really big deal. We've got pilots in about 8 countries that are underway. And so that would be what a significant sort of achievement. I think, again, in terms of a crisis response during the Mpox outbreak, we were able to work with health institutions like PAHO and WHO, Pan American Health Organization, to send out messages in 30 different languages across 75 different countries, also having a lot of impact, getting people access to information and services. And then I think just on the human rights aspect, which I think I sort of see inseparable between health and sort of human rights, is sort of there's kind of an artificial boundary, is we also work on the legal recognition of same-sex relationships. So we were instrumental in enabling our partners to fight for marriage equality in places like Czechia, in Japan, and in Thailand most recently. So we're really proud of that as well.
Jen, you mentioned some of your work around at-home testing. There's the CDC's Take Me Home program that was really an important part of that. What's happened to that program?
Yeah, so that actually grew out of our work, which we're really excited about. And again, Grindr was a huge supporter from the very beginning of that. And just to give a little bit more detail as to what this partnership looked like, at the start of our work with self-testing, we work with many different apps. Grindr was an early and ardent supporter of this work, and when we were working in a number of different health departments, Grindr was able to send, we were able to work with them to send geo-targeted messages to those specific locations to let folks know that testing was available in their area. CDC recognized that there was opportunity here, and especially as this happened to launch right as COVID was hitting, there was really a need for any testing that could happen online, where people could order online and did not have to go in person, and then put out an award for a 5-year national project. It was at this time, actually, that we recognized, okay, we've been doing this. This has been really driving a lot of traffic to people ordering to our platform in partnering with Grindr, but we recognized there was an opportunity to incorporate a button into the app. And so there is now a fairly prominent button within the Grindr app and a couple of other apps that we work with that help drive traffic all the time. So it's not just here's a message every now and then, but all of the time, and that is driving about 50% of our orders. And to answer your question, Celine, about what is happening right now, so again, as part of this national program, we can distribute up to 2 tests every 90 days to anyone in the US, as long as they're over age 17. And we've been doing that. We've put out over 900,000 tests in a little over 2 years. And this was we're halfway through our 5-year program, and we received a program cancellation notice. So needless to say, we've been very concerned about that. We have appealed that notice. And so at this point, we have some uncertainty. But if anyone in the audience happens to have about $10 or $12 million, I promise I will put it to very good use and ensure that many hundreds of thousands of people get HIV tests.
What has surprised the two of you most about how users have responded to these kinds of public health initiatives? Maybe starting with Mohan and then Jen.
Yeah, I mean, I think, what I would say is that maybe, I think not sort of an immediate surprise, but I think one that sort of takes a little bit of work is really understanding how to deliver campaigns and messaging. It's not one size fits all. but users respond to locally relevant, linguistically appropriate, and culturally sensitive kind of messaging and campaigns. So what that means is you kind of have to do the hard work of doing your research, working with in-country organizations, partnering with the right organizations who have credibility, kind of vetting them before you run a campaign. And I think we've actually seen some really high response rates. We work also with researchers who promote surveys within our app, and I think they kind of report that they have really high response rates in the survey promotion work. And so I think what that says to us is that people are really hungry for knowledge, but that's one that's delivered on their terms, and one that's not top down.
Yeah, Jen?
Yeah, so I would say in some ways, not a lot is a surprise, and that is because all of the work that we do and any recommendations we make to apps comes from getting input from dating app users. So we partner with research institutions to collect data, and we also have our own surveys, interviews, and focus groups that we conduct to ensure that we're getting really robust input before we put forth any recommendations. So in some ways, it doesn't go to the dating apps until we know that it's something that's desired by dating app users. However, we have been really pleased and surprised by the high level of uptake. So in some of our academic collaborations, we work very closely with Emory University, their School of Public Health, and they put out a survey to 10,000 gay and bi men across the US every year. We've added many questions over the years, asking a little bit about dating app use. And through that, we've been able to sort of ascertain the uptake of use of these sexual health features on dating apps. And we've seen that growing over time. And at this point, our most recent data collection, which was a year or two ago, what we could see was about 60% of all of those of the gay and bi men surveyed in this large survey indicated that they were using some feature around sexual health. And again, that might be that they're indicating their preps, whether or not they're using PrEP. That might be that they're saying that they use condoms, or that they're HIV positive and interested in looking for other people who are HIV positive. But in any case, we see a very, very high uptake from that survey.
Maybe another point, Celine, to add to that is I think trust is a really important factor, which I think is kind of a learning for us. That sometimes we noticed when we directed users to third-party websites, the sort of the engagement drops. But if it's in-app or if it's a trusted local organization, there's more of an engagement. So I think trust has become a really sort of big deal for public health. More generally.
What are some of the other things you've done in terms of trust or accessibility? You mentioned having it in the app or using local organizations as opposed to the sex party circuit. What are some of the other things, maybe starting with Jen and then Mohan?
Yeah, well, I'm going to take this a little bit in the context of self-testing, right? But we really recognize that we need to make it easy, right? So for the end user, we want self-testing to be free. And what we hear from end users is that what's most important to them is that it's free, it's easy, and it's discreet. And I think that discretion piece is also incredibly important. So ensuring that a package that shows up at their house doesn't say HIV test on it, right? I mean, that may seem obvious, but you will not believe how many people go through the ordering process and send us a message saying, what is it going to be on the package? And so, of course, we want to make sure that that's prominent on our website, that you can see, here's what the package looks like. You don't have to worry about this. So we want to really keep it simple. Another piece, and I think this is really important for people who are working in public health to hear, is trying to find a good balance around data collection. So we want to make it easy, right? We have almost no eligibility questions. It's really just based on whatever criteria may be needed. So it's generally speaking, it's a zip code and an age that we're asking for, and that's essentially it. And then from that point, you can go ahead and order. You put in your address. It's going to come to your house. We make it as simple as possible. However, after that, we're going to ask you some more questions, because of course we know data is important, right? And we want to be able to learn, well, who's ordering, and we then will also send up a follow-up survey and learn more from that point. But really, we want to keep it easy. And then a third point I will bring up is around being judgment-free. So we hear very frequently in terms of what are some of the barriers to testing is that people either are worried about who will see them when they go in. They're worried they might be judged when they go in to get an HIV test. And so how do we just make this process really simple and straightforward and judgment-free? And those are some of the really key elements, I think, that have helped in terms of building trust.
Mohan.
Yeah, I mean, I think without repeating what Jen said, I think it's also just meeting users where they're at. And so, I think sex positivity, I think, is an important lesson. I think we often think about HIV within a disease framework or a risk framework, and I think there's some fatigue around that kind of messaging. So I think sex positivity has a lot of value in the way we think about campaigns. We also, may not get it right the first time. So it's a process and it's a journey. So we have to kind of, use the data, use feedback loops to actually understand why things are working or not working, so that we can sort of scale impact. I also think, using big moments like Pride Month, right, where we know there's going to be a critical mass of users, in Pride marches. We're doing a big push on National HIV Testing Day this week that we're excited about. So I think using those opportunities and also thinking about messaging within the context of broader sexual health. So HIV is not just one issue. There might be a broader set of, sexual health issues that would be relevant for users, right? So I think those are some tactics.
Yeah, there's a much broader array, actually, of issues, whether it's, you mentioned syphilis. We're dealing with a congenital syphilis spike in this country right now, so that's affecting babies. We've seen increasing rates of chlamydia and gonorrhea, which, by the way, can be important causes of infertility for women because you get scarring in your fallopian tubes. HPV, cervical cancer. We've already talked about Mpox, so there's quite a range. What kind of in-app features or tools have worked well on Grindr or other dating apps to support users with respect to sexual health? We've talked about testing. Are there other such tools?
Yeah, I can start and then pass it to Jen. I think, we do sort of in-app takeovers from Grindr for Equality, which, as soon as you open the Grindr app, there's a pop-up message. And in a lot of contexts, it's about, information about health, access to services. In some contexts, it's actually more sobering that we warn users about risks that they might face in that particular context around safety and security. We have a sexual health resource center in 60 languages, which I was really impressed and blown away by when I first joined Grindr. And I think having sort of materials in there across a range of different issues around sexual health and identity and communication and navigating sort of spaces, I think is a useful resource that we have, and it's a growing resource which is also available in the app. And then we have a number of product features itself. Ones that you mentioned at the start, which is you can sort of indicate your HIV status, when you were last tested, your vaccination status, if you're in PrEP, and most recently we also introduced I'm on DoxyPEP, which all of you know is a prevention approach for STIs. And so I think we have all these different strategies. We're also gonna, I think if you have the option of getting reminded based on your most recent test date, it's optional, and you can sort of do that as well. And then we have a number of safety features, which I think are also important to mention in the context of public health. Given that in a lot of contexts, making connections can actually be more risky. And so we have features like not having the geolocating feature, which is what we're known for in places where it's really risky and unsafe for gay men and bi men to connect. The ability to kind of take a screenshot and then use it to blackmail another user, so we prevent screenshot capabilities. You can sort of make your messages disappear. You can send pictures that are private. You can hide and block users. You can report users. So I think all of those pieces are still kind of within the broader realm of protecting the well-being and health of our users.
Jen?
Yeah. So we have a campaign that we run called Nice AF. I won't say what AF stands for, but I think most of you can figure that out. And really, what we do with that is it's our intention to kind of understand and address some of the challenges that dating app users face. And so we have done some sort of anti-stigma efforts around that, and that has led to quite a number of recommendations that Mohan noted around safety and feeling safe on the apps. And we've also focused more recently around substance use and how users have to navigate that. It's a very complex topic. I won't get into too much detail here, but needless to say, there are many, many nuances. And we recognize that on dating apps, there's a range from folks who are sober, aren't interested in using, use occasionally, or specifically are on the app in order to find someone else that they want to use substances with, right? And so there's a wide range there. And we've made some suggestions and recommendations to dating apps. One of the apps that we've worked with has incorporated one of those recommendations, which is an I carry field. So this is really around prevention supplies, but it's inclusive of both prevention around HIV and STIs, but also around harm reduction. So we have I carry condoms, I carry drug test strips, I carry naloxone, I carry lube, and just sort of being able to indicate that through the app to make it easier for folks to know that that's something that's available. But the other thing that all of these things do that I think is incredibly important is that they help reduce stigma, they help normalize talking about these topics, and they help inform, right? So when we were working with Grindr on incorporating a DoxyPep option, what is DoxyPep? Does everyone know? Do all the dating app users know? Probably not. So there's an icon.
Do you want to explain?
I'll have Mohan do it, but I think yeah, go ahead.
Yeah, I mean, I think DoxyPep is basically doxycycline, which is an antibiotic, which I think we've used it for other situations like acne and other, infectious diseases, including sexually transmitted infections. But I think more recently there's evidence that it has preventive capacity, right? So if you take, I want to say 200 milligrams of doxycycline, around the event of around your sexual event, then it can reduce, sexually transmitted infections by 60 to 70%. And we're here talking about gonorrhea, chlamydia, and syphilis.
Yeah.
It's probably most effective for chlamydia and syphilis. Gonorrhea, we have more drug resistance, so it's something to be aware of too. This has not been approved for straight women, and this is something the CDC was investing in doing research on. There are some issues with compliance, which is why some of the early data was sort of iffy, whether this was going to be a good approach for women. But this has been approved for men who have sex with men, trans women, and it's really an important tool.
Yeah, so I guess all of this is to say that we also recognize by adding these features in, we have ways, that's an additional way of letting folks know that what they are, right? So there's often an icon like I for more information, and then they users can click that link out to get more information in the Sexual Health Resource Center. And so we write an article about what is DoxyPep and why someone might choose to use it.
How have shifts in funding or the political climate affected your ability to do this kind of work on the apps or to launch new public health campaigns in this way?
Yeah.
We just talked about the Take Me Home funding, and it's a little bit up in the air whether that will continue. What are some of the other things, some of the other ways in which this is impacting each of you? Maybe Mohan first.
Sure. I think, it's certainly affecting the HIV sector globally and domestically. And so a lot of the work that we do, we're a tech company, and so we rely on partnerships like the partnerships we have with building healthy online communities to really implement our programs. So a lot of the programs that we run in partnership with organizations that funded by institutions like PEPFAR and USAID, are vulnerable, they're shutting down or have already shut down. And so we've also kind of studied the impact that it's had in several of our partner countries and contexts. And so I think, it's everybody sort of scrambling to look for, ways in which we can sort of fill the gap, and the gap is really, really, really huge. And so I think, we're really trying to figure out what opportunities might exist to help, fill those gaps. I think one of the opportunities is that, users are still on the Grindr app, and we still have access to those users. So I think there's kind of an opportunity to promote health and service access through the app. And so I think it sort of reinforces the need for partnerships like the one that we're talking about with dating apps.
Jen?
Yeah, I'll just add a little bit to what you were saying about the global health work. And I want to acknowledge, so as we were mentioning earlier, we worked with Grindr to incorporate this in-app button to link people to self-testing. When we saw how successful it was, I think on both sides, and I know Mohan, you weren't in the role at this time, but on both sides there was a recognition of there's a lot of opportunity here. Once the technology is already there, from the technology side, it's a very light lift add this and offer this in other places. So we began to work more closely together to identify places in other countries where there's always an in-country partner. There's either already the self-testing infrastructure, and this would really support demand creation and kind of make it easier for folks to find out about the tests and to get directed to the tests. So that's something that we've been working on over the last year and a half. And so in the context of the recent funding landscape changes, there have been quite a number of stop work orders, and about 6 different countries that we were actively working with either had to completely stop work. Some of those have now begun to restart, and we're in process in Cambodia. We just launched a pilot, but a number of other countries are still scrambling. Nigeria, for example, and Ghana were both countries that we were making a lot of progress with, and there's been a lot of backsliding since that time. The second point I'll make is a little bit broader about funding in general, which is that this kind of work is very hard to get funded because it is so non-traditional. So when I go to a funder and say, I'm going to spend 10 years building relationships with apps so we could do this great work, it's very hard because funders think like, well, how can you count things and give me numbers, and and that's really challenging, right? So being able to say, we're working toward building these relationships that we recognize. We really think of the apps in many ways as kind of an environment, right? So what are environmental changes that we can make that might facilitate communication around sexual health, but it's going to take time to build that. And so I am excited to be in a space like this where I think there's so much recognition for those non-traditional, that non-traditional work and the non-traditional partnerships.
Yeah, and I think finding the funding for sexual health as opposed to just HIV is particularly challenging. And I will just say, in the private sector, we've been doing our own fundraising for our work. And the number of times I've had a meeting, it's usually a white male VC who's in his 40s or 50s or 60s, who will say, I've never been on the dating apps. I would never do that. And I will say to them, well, I met my husband in 1995. I had never planned on ever dating again, and then he died. And what would you do if your wife died tomorrow? Would you stay single for the rest of your life? Let's say you're 55 right now. So I think sometimes we don't think about this as being our problem. We think it's somebody else's problem. But I think that is something that does need to change in terms of how we approach, how we fund some of these other public health areas. You touched on something, Mohan, that I think is actually important, this idea of risk framework in public health. And that is how we think about things in public health. We think about what are the risk factors, how can we address the risk factors, or what are the protective factors as well, how can we promote those? That's a different way of thinking, at least in some ways, from what you want to be doing here. Could you comment a little bit on how you think about that in this context, and then maybe Jen as well?
Yeah, I think it's really sort of, I come from a framework of community empowerment and resilience, and sort of, why do we want to connect with each other? It's desire, it's a need for connection, and it's the need to be sort of feel seen and heard. And so I think it's really sort of acknowledging that piece. And HIV is sort of an unfortunate, outcome of some of that, connection we want to experience, right? And so I think framing sort of relationships and sexuality and sex around a disease, I think, is sort of, a missed opportunity to really talk about what drives us to each other and as humans, right? And so I think it's really about framing things, within the context of connection, and also focusing on resilience. I think we talk a lot about what hurts us and harms us, but also like what are the protective factors, to your point, that keeps us safe and keeps our communities safe. So I think sort of thinking a lot about that in the context of how we not only message to our users, but also how we train providers and physicians so they can have those kinds of conversations, in the clinical settings, I think is really quite important. And certainly that translates to policymakers as well. And I think just a quick point on the funding cuts is we've also not been sort of passive as Grindr. Yes, we're a tech company, we're not an advocacy organization, but then we've also been in DC educating, policymakers on both sides of the aisle, and really kind of vocalizing the impact that's had. And I think in all of those conversations, we really try to bring to view that this is something. It's not a disease. It's not risk. It's about connection and community.
Yeah, I don't think people who get married say, "I want a sexless marriage." So it is very much about connection, and people view it in different ways, and it can mean different things to different people. Jen?
Yeah, I would just say I think it's very much about normalizing sexual health in the context of dating and of being on an app. And so again, if you're on an app and you're looking for something in particular, how do you also have information around sexual health just be a natural part of that? Again, once we've incorporated any of these features into the product itself, it's already there. So it becomes normalized and it becomes just sort of, yeah, this is how how I fill out my profile, and these are information I can see about potential partners.
So I'm going to ask you one last question and then open it up to the audience. Looking ahead to 2030, what is the best case scenario for this intersection of dating apps and public health?
Do you want to go first, or do you want me to go first? I think, 5 years is not a long time. Actually, just 5 years ago, we were at the start of a global pandemic, and so it's hard to imagine a lot of change. But I think at a very basic level, I think the conversation that we're having here kind of surfaced up the need for the LGBTQ community to kind of have an equal place in society. And so I think a world where it's not illegal to be gay or to be LGBTQ, right? And if dating apps can contribute to that in some way to help kind of normalize the queer experience, I think that'd be really great. I also think that the end of HIV, there was a lot of momentum around that, both from the US and from multilateral organizations. 2030 was the year where we were going to end HIV, and so I think about the end of HIV or making a real dent in HIV prevention and access and treatment globally by 2030. And dating apps, I think, have a huge role to play in that.
Yeah. Jen?
Yeah, I'm going to just start briefly by talking about self-testing. I think there's opportunities here in the technology pipeline for more and new self-tests to be available in a wider range of diseases, and for those to go through the approval process. So in the US through FDA and in other countries through the equivalent approval process to make it easier, right? To be able to test at home and to be able to easily access testing. And I think the connections, in the case of HIV specifically, I think, we have people coming in to test, and I don't think I shared this, but about 25% to 33% of our users in our various programs around self-testing have never tested for HIV before. So while we originally started this because we wanted to reach people who hadn't tested for HIV, we have succeeded in that. And so that's been really exciting. We're engaging a whole new group of people who otherwise were not accessing these services. Now we can also link them to other services, including PrEP. And in our cohorts, we're seeing very, very, very few, about 5% of the people that are coming in to test with us are on PrEP. And this is a group that's predominantly eligible for PrEP. So there's a huge opportunity. So I think we really want to increase those linkages and opportunities to connect people to PrEP and to other STI testing, other prevention services. And then also expanding our work with the apps. So as you noted very wisely, we do feel that the apps that are working in the gay, LGBT dating space have been definitely the leaders, and we have, really started working with those apps first, and they have been leaders in putting sexual health, fields and information on their apps. And we have and do work with apps that are more mainstream and are not specifically for the queer community. And it's a challenge. We're working on it. We do have messages that go out, for example, around HIV testing day, around some of the awareness days that go out through app partners that we have, like BLK or CHISPA, which are specifically reaching communities in the Black community, the Latinx community. So we're really excited about that, but I think there's a lot more to do there. And then finally, I will just say that I think there's huge opportunities for funding these non-traditional partnerships and the non-traditional work in public health. And in my sort of second hat, I am the executive director of an organization called Springboard Health Lab, and we seek to do that and to support ideas in public health that really need, that otherwise are not going to get funded and supported, and just really need a little bit of extra support and incubation.
So just to plant a couple seeds with you guys, you may or may not know lenacapavir was approved by the FDA on the 18th. This is a medication, this is the closest thing we've ever had to an HIV vaccine. So it's an injection given twice a year to prevent acquisition of HIV. Some early data shows that it may be, we can give it even just once a year to prevent acquisition of HIV. But at the same time, you're seeing HIV prevention funding at the CDC being cut. these are the very people who would be getting the information out there, promoting the testing. And so there's a real role for the dating apps to play right now when the public sector is not going to be able to do that. So, I think you're going to play an important role.
Yeah.
So let's open it up to the audience here. Here in the glasses.
Hi.
And if you could just briefly introduce yourself.
Sure. My name is Heidi Goldstein. I'm with Global Action to End Smoking. And we talked a little bit about the intersection of dating apps and public health. We talked about unlikely allies. And we also talked about the LGBTQ plus community, which we all know, I think, has a higher smoking prevalence than other communities. And I'm just wondering, there's a lot of misinformation about smoking cessation and specifically tobacco harm reduction out there. And I'm just wondering if you think that there might be any place for accurate information for adults who smoke and use dating apps where we could potentially provide information to help them on their smoking cessation journeys through these apps.
I'm happy to take that first, and yeah, thank you for your question. I think we talked a lot about the HIV piece. That's kind of the nexus of our partnership here, but the campaigning work that we do is really issue agnostic, and we promote awareness on a range of different issues, and I do think that one of the most powerful tools that dating apps can provide is being a conduit for community education and awareness raising, so absolutely. I think the short answer is yes. I think the more convoluted answer is, making sure that it's context specific, culturally, sensitive and all of that, and what are the moments we can sort of use to, promote those messages, what kinds of users might benefit in which context. So absolutely, I think the answer is yes, to promote kind of broader public health.
And I'll just very briefly say that in our work around substance use, we saw that smoking came up a lot, and there actually are a number of apps that specifically allow folks to indicate their smoking preferences or not. And, in terms of what someone's looking for in a potential partner, that may be very important. So just to note that.
Next question. The black woman with her hair up here.
Hi, all. Thank you so much for all of your work. This is super important. I'm Victoria Nichols. I'm the Senior Project Director for Free the Pill, which is a coalition that helped bring the first birth control pill over the counter in the U.S. It's called O-Pill. It's on the shelves nationwide now. And I have a similar question about contraception and if there's any opportunities to give people information about what they can get over the counter. There's really lack of awareness about both the difference between emergency contraception and O-Pill, and that O-Pill even exists. And I just see this as a really great opportunity to get people to know that they can just pick it up off the shelf before they meet up with somebody, or they can, for emergency contraception, get it after, or be on a daily birth control pill without having to go months to wait for an appointment with a provider. So thank you.
I can just say thank you for your work. And I believe that on a number of our self-testing platforms, we do have resources around contraception. And I believe we do have O-Pill, but I will follow up with you after to make sure. But yeah, so we want to make sure that any kind of relevant resources, are listed on our site so that folks who are going through that process can access other resources.
Next question. The gentleman in the back with the glasses.
Hi there, thanks for this great panel. I'm Christopher Pepper. I work for San Francisco Unified School District, working with young people. I'm thinking about high school health education classes where we teach about sex ed, we teach about HIV and STD prevention, and we talk about dating. And I'm wondering, since you've thought so much about messaging, are there any messages that you wish maybe future dating app users who are now teenagers that they learned at an earlier age about any of the topics that are coming up in your work that you're trying to address with adults?
Yeah, I mean, Grindr is an app for users above the age of 18, but I used to work at the Trevor Project, which is a suicide prevention organization that also has a lot of resources for young people and teenagers not only including mental health, but also sexual health. So I would sort of encourage you to take a look at their website and resources. They have a number of public training initiatives where I think there's some really useful resources. UNFPA used to have a comprehensive sexuality education program, and they had some resources. I don't know how relevant they might be to the context in San Francisco, but that's also worth looking at. And Jen, you might know.
Well, actually, what I was going to say is that thank you for doing what you're doing, and that I think it's unfortunately probably more rare than we would like. And for many folks, what we've found is that the first place they're getting sexual health information is the dating apps, which is, again, another reason that we feel it's so important to partner with dating apps and to have that basic sexual health information on the apps, because unfortunately they're not often getting it in schools. So thank you, and may there be more people like you out there.
Next question. The gentleman here on the left with the glasses.
Hi, my name is Brody. I'm a cardiology fellow at Brigham Women's Hospital. So this has been a great session. So a few questions. I guess I have two. One of them is, I think we know that LGBTQ plus individuals have worse cardiovascular health, and part of that is actually missing out on primary care. And so, is there, on your app, a way of getting LGBTQ plus individuals getting connected to LGBTQ plus providers? Is there also a role in mental health? Because as much as sexual health is important, those are other two areas which will probably help us improve that health. And the second question is, do dating apps have a fiduciary responsibility of actually lending some amount of their profits to fill the gaps that the funding will lose, or to have PrEP being accessible in places where it's not available and very costly?
Yeah, great questions. I think the first question, I'm really glad you raised it, because I kind of wanted to say this in the 2030 vision question, but we talk about building the global gayborhood at Grindr a lot, which is really about integrating access to services within the Grindr experience. And that sort of, it's a great idea and vision, but it's harder to do because, it means sort of evaluating the ecosystem that exists in every given country context, making sure that the providers are in fact LGBTQ competent and sensitive, which are two different things, and also that making information available on an app like Grindr would actually be safe and secure to do that. But we are piloting that in a few countries in Asia this year to figure out how we can kind of create access to services more broadly within the Grindr experience. And so it's definitely sort of something that we're kind of top of mind for us. And that includes mental health as well, in the sense that, harm reduction is one, gender affirming care, mental health, crisis support, beyond just information and resources. And the second question was around... Yes, I'd like to think that, Grindr for Equality as an initiative is part of that, but I think Grindr for Equality was really born out of need. And the recognition, especially in the Middle East and North Africa region, that human rights crises affecting the LGBT community were really quite sobering, and needed intervention, and that's how the initiative started. But since Grindr for Equality sits within the corporate structure, it's very much something that we take a lot of responsibility and pride in helping sort of not only help our users and communities, but also help elevate our brand in being a socially conscious dating app. So thank you.
Well, thanks to both of you. A panel I moderated this morning was titled Reimagining Public Health. And I think you guys are, in fact, reimagining public health, meeting people where they are. And as some of our